All right, we're going to be talking about the latest trend in Hollywood, and it's huge, according to Dr. Maryam, and it's quite surprising as well. Welcome to the show this morning.
Thank you very much.
What is it that all these Hollywood movie stars are lining up to do?
Well, it's called cosmetic acupuncture, and it is a very safe and effective way to reduce the signs of aging on the face. It reduces fine lines and wrinkles, helps crow's feet, frown lines, helps sagging skin, and really helps to bring a glow to the overall complexion.
Okay, so what kind of stars are we talking about here that are into this?
Cher is a big fan of the cosmetic acupuncture, Madonna, Gwyneth Paltrow.
Really? So is this instead of things like Botox?
Definitely. It is more subtle and more gradual than Botox, and it doesn't look as sort of artificial. It is a natural alternative to plastic surgery and Botox. It is a bit of a step down from Botox.
Right, so the results aren't exactly the same.
Exactly.
Okay, so how long has this been around, or is this something relatively new?
It actually is not new. Most people think it's new because they've never heard of it. But it actually has been traced back to ancient China in the time of the emperors and empresses, and it was actually used for the empresses and empresses' concubines for beautifying.
So why do you think then the people are more interested in doing this instead of, say, plastic surgery?
Well, there are a lot of advantages to this over plastic surgery. With plastic surgery, there's a lot of risks and complications. You never know really what will happen. It's very costly. Botox also, we don't know the long-term effects yet. Also, it is, again, very expensive, and it only lasts about 4 to 6 months or so. So you have to get another, dose of Botox done again.
So then how does this work, and how long do the effects of this last?
Well, actually, with the cosmetic acupuncture, it works on the whole body. So it brings the body back into balance and makes you healthier. So you don't only look better, but you feel better. With the insertion of tiny, thin needles into the skin, which doesn't really hurt.
You're talking about tiny, thin needles in the face here, right?
Yeah, but
okay.
A lot of people are afraid of needles, but these needles are so thin, they're actually 1/10 of the size of a hypodermic needle.
That's thin.
It's very thin.
Okay.
Some of them you can't even really see.
Okay, well, you know what? We're actually going to show this to people coming up in a few minutes here on the show. We're going to have a demonstration of that. But that's got to be sort of the hurdle that a lot of people have to get over.
Exactly.
Right?
And it's too bad because it really does work well.
Okay, and are there other ways that this could benefit you other than just looking good?
Yes, very often many patients describe it as a very relaxing procedure. They feel less stressed, really energized, they find they sleep better at night. And if there are any other symptoms involved, for example, menopausal symptoms, menstrual problems, digestive problems, those are addressed within the cosmetic acupuncture treatments at the same time.
So wouldn't it just become regular acupuncture then, not necessarily in the facial area?
So really it is regular acupuncture plus a lot of points on the face.
Now, Maryam, how do you find somebody that you can trust to do this? Because I can imagine that would be a big concern. If a lot of people are doing this, you want to go to somebody good. This is a pretty big step you're taking here.
Exactly. So you have to make sure that the doctor is licensed with the College of Traditional Chinese Medicine Practitioners of BC. Not only that, they should have special training in this procedure. So it's not something that you learn in school. You have to go out and do more training in it.
Okay, so how does this work then? I mean, you must have to go to a certain number of sessions over a period of time, right, for this to take effect?
So the protocol is 10 sessions done twice a week in the span of 5 weeks.
Okay.
Every session is an hour long, except the very first session is an hour and a half. So half an hour of it, I'll ask about the medical history and do a full medical assessment with the patient.
Okay, so then once you do that, the 5 weeks, then how long will the effects last?
It lasts from 2 to 5 years, depending on the individual.
Right.
And maintenance sessions are recommended to be done once a month or once every other month to just keep the skin improving.
Would that just be one session, sort of once a month? Or
exactly.
Yeah, that's pretty good. 2 to 5 years, that's kind of surprising, right?
Exactly, because, again, Botox will last about 4 to 6 months or so. And actually the cosmetic acupuncture, if a patient has done Botox, if they do the cosmetic acupuncture as well, it helps to upkeep the Botox, to make it last longer.
So it prolongs the Botox,
exactly.
Does it? Okay, now are you finding that more and more people are interested? Are they coming to you wanting to know more about this?
I would say about 30% of my patient load is specifically cosmetic acupuncture, and it's just growing every day.
Okay, there's got to be people though who shouldn't do this, that's not recommended for?
Yes, it's not recommended for anyone who is pregnant and anyone with frequent migraines where they're on medications for their migraines. Because there are quite a few needles used, it may be overwhelming.
Okay, when you say quite a few needles, how many are we talking about here?
Per session, it's about 30 to 50 needles or so. But really, it's
Really?
quite painless.
Okay, you know what?
And we'll show you.
Yeah, exactly. I was going to say,
I
we're
can
not
even
exactly
try it on
taking
you if you like.
No, I don't think so. We're not planning this on me. You brought somebody along that we're going to
Yes.
try this out on, all
brave
right?
patient.
That's coming up in a few minutes. There's a very brave patient. It's 9:24. You're watching Breakfast Television. All right, it's 9:36 on this Monday morning. You're watching Breakfast Television. Now, we're talking about cosmetic acupuncture. We are going to show a bit of this, and even though the needles are pretty small, some people might not want to watch this, so watch out there. There's the needles there, and these are going to go into, well, Pat's face. So if you're squeamish about that, you might want to just maybe walk out of the room for a couple minutes here. Okay, Dr. Mahanian is back with us now.
Thank you.
Pat, hi.
Hi.
How are you this morning?
I'm great, thank you. How are you?
I'm good, thank you. You're a big believer in this procedure.
I certainly am.
And why is that?
Why is that? Well, a few months ago, I was starting to feel that I was looking tired, maybe a little bit worn out, and then I went online to see what options were available to me. I came across cosmetic acupuncture and decided that's what I wanted to do, so it led me to Dr. Mahanian.
Okay, and you were looking tired and worn out, and you felt that this would sort of affect you at work too, didn't you?
Sure, a little bit, yeah.
You thought that maybe your boss would think that you weren't up to doing whatever?
Well, I think, in the workplace, if you had the option of hiring, if you were looking for a position, if you were looking elsewhere for a position and you were in competition with somebody who was maybe younger and looked more vibrant as opposed to somebody who was a little bit worn and maybe stressed looking, chances are the person who was more vibrant would
Get the job.
position,
So
you
you're
bet.
talking about that workplace pressure that Dave and I were just talking about. Okay, so Dr. Mahanian, what do we have to do here?
Well, basically, I first start the treatments to just sort of calm the patient down, and I'll do a couple of points in each ear to do that. I won't.
Pat looks pretty relaxed.
Yeah, exactly. Don't really have the time
Pretty
to do
laid
that
back,
now.
okay.
Use a bit of alcohol to just clean the areas.
Right on the top of the head?
Yeah, these points help to lift the skin.
Now, Pat, were you at any point ever nervous about getting this done?
Not at all.
No?
No,
Have you ever had acupuncture before?
no.
No, really? Okay.
Okay.
Process before you got to this point, right?
Pardon
You'd
me?
be talking to the person.
Oh,
This is-
oh yeah, explain everything to them, talk
Yeah.
about their concerns with their face, tell them what they can expect as far as results go.
Right. Pat, can you feel anything at this point?
Not a thing.
Nothing.
So if you can just look straight ahead. This is the lifting and pulling technique, and this basically helps to lift the skin and help saggy skin around the jowl areas.
Okay. And Pat, have you noticed any kind of a difference with this?
Oh, I've noticed a lot of difference.
Really? Mm-hmm. Oh. Okay.
And of course, when they're lying down, this looks a lot more comfortable.
Yeah, it doesn't look so comfortable right here, does it? Dr.
So just
Mahanian,
to
how
sort
long
of
did
show.
you train before you were able to do this?
Well, my schooling for traditional Chinese medicine
Yeah.
was 4 years long, and I trained here in Vancouver and also in China. And then, in order to be specially trained in the cosmetic acupuncture, I did a training in Toronto.
Oh, you did? Okay. Did you look a long time before you found somebody that you sort of thought, okay, this is going to work out?
Actually, I Googled my options and then I went ahead to see if anybody in Vancouver practiced this type of technique.
Right.
And it led me to Dr. Mahanian right away. So I did some research on everybody and then chose Dr. Mahanian.
Oh, nice. Now, how many different types of needles are you using here?
There are a few different types. This one is very thin, and it's used actually on the face. It's coated with silicone to get into the skin very easily without pain and without bruising and bleeding.
Oh, bruising. You had a problem with bruising early on, didn't you?
I did. I didn't notice it as much, but actually my boss noticed that I had some bruising on my face, and he asked me one day if there was anything that I needed to tell him, if I was in a new relationship or something.
Now, that's nice, though. Your boss was concerned about you, right?
Absolutely.
That was very nice of that person.
Absolutely. I
Okay.
didn't notice it, but they did.
Okay.
Yeah.
And you had to tell them, no, it's just acupuncture.
They didn't know, yeah, I didn't tell them I was having this done, of course, so I guess he was just wondering.
That
Why was-
really is the only side effect of this procedure is there may be a bit of bruising.
Very
It may
slight.
just be one little bruise in the whole 10 sessions.
Pat, did
So
you not feel that one at all?
No, not at all.
I felt it. How could you not have felt it?
I don't.
Really?
we can
Not
try
at all.
you as well.
Yeah, no, I don't think so. You know, I thought about it during the break, and I don't think I'm up for this today. You have to do the relaxing technique before we just do it to me.
Right, sure.
So how many needles are we talking about here?
Well, typically in a session, I would do about 30 to 50 on average.
Okay. And you find this very soothing, and you just kind of hang
Absolutely.
out and relax during it?
In every session, I've gone straight to sleep.
You must be recommending this to everybody you know now.
I do.
Straight to sleep. That would be pretty good. So what areas do you focus on with most people then?
With most people, it's definitely frown lines, also to lift drooping eyelids,
Yeah.
and help the jowl areas and the folds around the mouth, crow's feet, dark circles, bags under the eyes. But in every, with every patient, even if, for example, crow's feet is not a concern,
Yeah.
I would still do that area because it is a preventative treatment as well.
So it could prevent wrinkles
Exactly.
to some extent?
As you're stimulating collagen production, it will prevent wrinkles.
And
from
that's what it
forming.
is that you're doing, you say?
Yes,
Right?
increasing energy and blood circulation, moisturizing the skin and oxygenating the skin,
Okay.
and filling out the fine lines with collagen production.
All right. Well, listen, thank you very much, ladies, for joining us this morning. Pat, you're very brave to come on TV and do this with us, so we thank you for that. Let's get out to Tash.